I just think that good care for women means that we examine them. Whenever I talk about mammograms for screening or mention breast exams, there are always naysayers that will spout these nonsense statistics that mammograms or breast exams don't decrease mortality in women with breast cancer. And it makes me crazy because mortality is not the only endpoint here. Living through cancer is not the only endpoint here. Catching things early allows women to have less treatment, less invasive treatment, no chemo, potentially no radiation, lumpectomy and not needing mastectomy. Catching things early means better care for women. Even if they live through it, if they can avoid all of the extensive treatment, shouldn't we want that? And then there's all the other ickiness that comes along with this for patients. Like they'll say, if they're symptomatic, then of course we'll do things early. Of course we'll do an exam. Patients don't often know if they have a palpable mass. I see patients all the time that come in with cancers that are found on mammography where they have a visible lesion that the patients themselves didn't notice because it grew slowly over a couple years. And the clinician that ordered the mammo never examined them. I just think that good care for women means that we examine them and we recognize that mortality is not the only endpoint. Our patients' quality of life matters. We can't expect them to be clinicians. They frequently don't notice things. And this idea that things are symptomatic that will lead me to do the right exam, that's not screening, right? This is supposed to be screening. And again, for the 100th time, mortality is not the only endpoint. And then finally, people will always say that harm comes from these things. And the harm is always in the form of a biopsy that the patient didn't need. What about the harm of missing things? What about the harm of the chemotherapy they maybe wouldn't have had to have? What about the harm of the more extensive surgery? Sure, again, they lived through it, but what about that harm? I feel like we're focused on the wrong things sometimes with these recommendations and how people hold so firmly to them. Examine your patients, please.